This Pitch Breakfast video is brought to you by Spangler and Agins, attorneys for Charlotte's startup community.
Joel, you ready to go? Come on over. First up this morning, ladies and gentlemen, is Joel Succo with Pure Surgery.
Good morning. My name is Joel, and I'm going to talk to you about healthcare for the next couple minutes. I've been in this industry for more than 10 years, specifically in specialty surgery. I've been in operating rooms on 5 different continents, and I can tell you firsthand about the difference in quality from country to country, which is why I question the 1.4 million Americans that left this country last year for care. At the same time, I work with surgeons who are trying to acquire this exact same patient, and that's why we started Pure Surgery, to connect patients and doctors. See, the problem is elective surgery patients don't have the resources to make informed buying decisions. Our solution is a digital platform to empower and educate these patients, to bring together buyers and sellers under one roof and give them the tools any consumer would want when they make a large online purchase. We're not the first people to talk about free market medicine, and we're definitely not the first to offer a price transparency solution in healthcare, but we want to leverage these two ideas to create an end-to-end solution for these elective surgery patients focused on leveraging the best in telehealth and remote care. What's the market for this? Well, it's destination medicine, but it really is anyone looking to pay cash for surgery. Last year, the medical tourism market in North America was $15 billion. It's also insurance denials, concierge medicine, potential people who are in high deductible plans. We wanted to test this market, so we ran a pilot. We stood up an acquisition funnel for 60 days. We acquired 30 patients. To date, 2 have had surgery. The business model, we create value for our healthcare service providers by bringing them out-of-market cash-paying patients, and we share in the upside. The team, myself and my co-founder, have 20-plus years experience in healthcare. In addition, while at Red Ventures, I helped them create and optimize digital platforms specifically for the healthcare industry. The ask is $300,000 for a tech build, marketing dollars, and operations. Thank you.
Good job, Joel. Excuse me. I will start by saying that you did a great job. I think you started to dip in a little bit in the middle of it, but you started great. I think the most important thing that you can do in a 2-minute pitch is to establish credibility. And it's probably the toughest thing because you only have 2 minutes. How are you going to establish credibility? But I think you did it by throwing a few numbers, and that's what you got to do, right? Really quickly, you got to say, is this person that I'm talking to or that I'm listening to have any credibility for me to pay attention to? And then, so you did that well. You've been in healthcare 10 years. You threw a few numbers and a few names and a few keywords, even though you didn't, fill this in with too many strenuous words that we wouldn't be able to understand. So I think you did a good job to do that, establish credibility. I think you also got into establishing the problem, and throwing some numbers is a good thing. Not to overdo it, but I think you did a good job of that. Where I started to not quite fully understand is sort of right around the middle when you started to talk about the problem and the solution. And it's tough, right? Like the difficulty of a 2-minute pitch is how you're going to fit everything. And so I came away understanding the problem that you're tackling, but not having really a good sense for what it is that you're doing, what your solution does, how you differentiate from others. We have heard pitches like yours before. And whenever you find a space, whenever you're pitching about a space that is similar to where others are competing, you want to be able to talk about your differentiation. I really have no clue what your differentiation is. Without that, I think it's going to be hard for me to say, I really want to have another conversation with Joel. So I would just focus on that. I'm trying to think about your differentiation, and that makes the ask even relevant and everything else that comes to it. So that's my feedback.
I would agree. Very succinct in 2 minutes to get a lot. This is a difficult area for a lot of people to understand. One of the things that threw me a little bit was the focus on going out of country, and the real reason they're going out of country is because they're not getting insurance, I assume, insurance payments to cover their surgery. I think you need to make that very clear, and the numbers are good, but from my perspective, and I think an investor may not understand what the magnitude of the market is and the aptitude of the potential patient. So what's the uptake? If the market is for X billion dollars of surgeries, what percentage of that do you think your business can attract? And that relates back to what you need the money for, and that's to build the app. But I'm sitting here saying, well, it's an app, but how easy is that app for someone like me, an old shit, to understand what it is and how can I get access to it, and the qualification of the medical services that are being provided. That would be one of the most important things. So I think if you hit those two things and drive that home, hard to do it in 2 minutes, but I'm always one looking at what's the market potential for this, what's the niche, and don't tell me you're going to boil the ocean here, that you've got a very clear niche that you're going to focus on.
You want to respond to either of those?
Sure, I'd love to. And I didn't do a great job explaining that because it's not an app. It is basically it's an acquisition funnel, and it's focused on these high-dollar elective surgeries. So that would be right now bariatrics and orthopedics, and it's focused on giving people who would be medical tourists a better option. We know these people are out there; they're reaching out to us. Of the 1.4 million travelers that left this country last year, we think it's about 100,000 between those two therapeutic classes. When we reach out to people, a lot of times they don't understand their option or the difference in cost. They're told a number that's 10x what some of our surgeon partners are willing to do this. So one of the other trends was a lot of in our network, we had a lot of surgeons that were standing up physician-owned surgery centers across the country in different states. They're willing to put together a package in a bundle for one price for the entire episode of care, and then they're giving us that bundle to go market to these out-of-market, incremental cash-paying patients. So another thing we learned in the pilot was they valued these patients so much because they're out of market and they're paying cash that they're willing to prioritize them within their workflow. So people who were told they had to wait 6 weeks for surgery, if you're a pure surgery patient, they'll get you in next week.
So your customer is the care provider, correct?
Yes.
And I mean, you're almost a digital marketing platform as much as anything. Is that fair to say?
That's fair to say,
Certainly
yep.
with your Red Ventures background. So instead of getting me to sign up for DirecTV, you're getting me to sign up for, a lap band surgery, basically, right?
Very true, yep. And that's my Red Venture
But
background.
I say that tongue-in-cheek, but I think, and it came out at the very end that your Red Ventures experience, and I think for those of us right and around here, a lot of people know that, but I think kind of to Lister's point, and generally you did a great job for sure. I don't have a lot to add here, but your digital marketing experience and the uniqueness of what Red Ventures does and how they've done it, combined with what sounds like some pretty deep experience on the medical side, I think maybe try and move that piece up to the front because it gets to this credibility and it gets to the differentiation, I think.
I'm still trying to, I was hoping you would answer the question of how you get customers, how do you acquire customers? And the point that John is making is a good one because just to say I worked at Red Ventures, that might help some people, but that's not going to help everybody. And then maybe to make the connection, okay, maybe I learned something at Red Ventures about reaching people that will help me here. But explaining that, again, we're asking you to explain a bunch of things in 2 minutes, and you have to give some things up. But to me, that's the key, because once you establish credibility, I don't think you need to talk too much about the market size, because everybody knows that healthcare is expensive. Probably people can assume there's a lot of money to be made there. If you can convince them that you have a great way to attract customers. I'm still lost as to how it is that you do that,
Sure.
even with your Red Ventures background.
Yep, and it's an acquisition funnel. We ran the pilot in paid search. We bought really long tail keywords for people who were, we could tell that they had already done a lot of research. So in a therapeutic class, it wouldn't be someone looking for education. We could define keywords or people looking to actually purchase care. And we targeted those long tail keywords. We brought them into a basic web page that we had set up and just ran it as an acquisition funnel. Give us some information. We connected the dots with some bolt-on third-party products that were all HIPAA compliant, form fill, call recording, and then we had a telehealth service to actually connect the physician to the doctor for a remote kind of office visit. All this stuff was HIPAA compliant. It all could be downloaded into a physician's EMR and saved as a patient's medical record. And that was the funnel. We would find them in paid search, bring them onto our website, ask them for a little bit of information, set them up with something of value, which was a free consultation with one of these surgeons. And then the people that were candidates for surgery, we would then take them down the path of setting up travel, hotels, pre-op optimization, and then moving forward, the other thing that we noticed during the pilot was there's value to keeping these people in our ecosystem and on our platform because it affords these cross-sale opportunities. So now we have a handful of other healthcare providers that we're starting to have conversations with that are interested in our patient population.
How much does it cost you to acquire a customer?
So our currently it was $500 our CPAs right now. We have 30 patients in the funnel to have had surgery, so if more people schedule and complete their journey, that price goes down immediately, but it's $500, and we're working off of 10% of the total cost of the operation as our bounties. So those are $1,000 to $2,000 per patient. So currently it's marginally profitable.
So one other thing maybe to think about, and this is a question. So you ran a pilot, and then in the Q&A you've referenced at least one physician-owned surgery group. You're raising the money to build out the platform. Is that right?
Yes.
Okay, so are those pilot customers basically waiting to become actual customers?
No, they've already completed their journey of having surgery.
I don't mean, no, they aren't your customer. The surgery center who you're working with, are they basically just saying, yeah, we want to keep using this?
Yes.
Okay, so my opinion, I would maybe try and work that into your pitch that you essentially already have customers lined up. Okay. Because I think that at this stage, that's a differentiator, right? So make it, and again, it's 2 minutes, it's tough. We're giving you a lot of stuff, but it differentiates, the statement that we've run a pilot and you've had two, these are customers that are on board, and we're just trying to build out. We're raising money to be able to scale this.
Just a quick question, because I obviously lost exactly who the customer was. If it's the service provider, do you know the frequency of patients that come in there for surgery and they say, do you have insurance? That's the first question they're going to ask, and you say no. That's a base of potential clients for that customer, right?
Yep.
Do you get that data?
We don't have exactly that data of kind of what is the cash paying market of surgery, people who are going outside of normal healthcare networks to get these type of surgeries done. We have picked orthopedics and bariatrics because we think it's higher than normal. We know fertility and plastics and dental is also massively high on that scale. There's kind of a symbiotic. One, it was our network was orthopedics and bariatrics, and two, there's a symbiotic relationship with the two. A lot of people who need weight loss surgery also suffer from arthritis. And some of our print media that we give to orthopedic surgeons is because they're sending patients out of their office who need to refer them to a bariatric before, and bariatric gets a lot of insurance denials immediately.
So I was trying to dig in on differentiation. Part of the trick of 2 minutes is what you're trying to accomplish typically is a follow-up conversation. You're not going to get an investment in 2 minutes. But and you want to be able to say something that will say, make that person who's listening want to talk to you again. And that's why I think differentiation is important. And if you're early, I think that the angle of we're planning on doing what in the medical space, what Red Ventures did, in the digital marketing space. I mean, that's one angle to use in potentially early on. But as you start to do more and generate revenue and get more pilots, maybe an angle which is different, but maybe just as effective or more so, is to talk about your numbers. It's to talk about the customer acquisition cost, the profitability. I think that's another thing. Because, in the end, no business is truly unique. So differentiation is tricky, right? To say you're truly different, there's always a little bit of an exaggeration there. So that's why people want to see traction. But if you can talk intelligently about your customer acquisition cost, the profitability that you get, the lifetime value of those customers, and then maybe talk about the future potential value by cross-selling, then people start thinking, okay, this is an interesting business that way. And you're able to acquire these many customers as pilots. So there's a story there. And so I think you need to pick that one thing that you have that somebody else will say, yeah, this is why I want to talk to this person again. And not just give them a bunch of information. You have to decide what that is and then pick that, either differentiation or the numbers and the traction, something that is going to be attractive. And I don't know if you want to answer to that, but maybe if there's time, I want to ask the audience to
Sure.
put some input or feedback or questions.
I'll give this in 30 seconds, yeah. So when we look at the market, we look at the competition and differentiation. The way we bucket it in three segments. There is the purely educational, that's Castlight, probably the largest one, and they're working off of a per employee per month basis going to employers. Then there's the ones that are focused a little bit more on kind of what we're doing, but they're focused on payers, not patients. So they've designed something for self-funded employer plans to help contain cost. And the third one is just a provider that's marketing themselves. So Oklahoma Surgery Center wants you to go to Oklahoma.
Joel Suko, ladies and gentlemen, Pure Surgery. Thank you, Joel. We really appreciate that.